So I am here today with Dr. France, and this is Level with Tina New podcast, episode number 1. So I'm so excited for you to be here today with me, and we're going to, really talk about self-care within mental health awareness. Just kind of giving an idea of what that means to us and the things that we also do in order to take care of our mental health. And so thank you for being my guest today, Dr. France. And I'm going to share with all our listeners and all our viewers a little bit about you and who you are, and then you can elaborate on where you are and what you do and things like that. So we're going to get started. So I'm here today with Dr. Dana France, family nurse practitioner, DNP, has worked in the healthcare field for over 25 years with experience in several roles, positions, and areas of the nursing community. She takes pride in serving the community while being driven by the desire to elevate the quality of healthcare delivery. As a nurse practitioner, her goals include contributing to the creation of a greater platform for the role of the nurse practitioner and aiding in the development of maintenance of healthcare programs that fuel optimal, comprehensive patient care. She holds a Doctor of Nursing practice degree and currently resides in St. Louis, Missouri. I am so excited for you to be on here today. And so share a little bit about you, who you are, and I gave a little bit about your bio, but tell me what you do and how did you have the desire to get into your doctorate in nursing?
So my name is, as you said, Dr. Dana France. I have been in the nursing field for many years. I actually got into it because I love taking care of people. I think one of the things is I just have people say that you were created a nurse, but I was born a nurse. So I was born to do the job that I do. So my purpose in life is to help others be the best that they can be. I am currently a family nurse practitioner. I work in long-term medical. I do primary care as well. I enjoy taking care of the elderly. I am a mother. I'm a wife. I'm a grandmother. And I just enjoy taking care of people.
And so a little bit about how myself and Dr. France associated is that we collaborated actually in some long-term care fields, but about 20 years ago? Was it
long
20?
time?
A long time. And so, I'm going to piggyback off of that, the love of nursing, the love of, your doctorate or whatever it is that you do, when we love it, we put that field into work and we're out to help others. And so I just want to say from colleagues to colleagues that I actually learned from you. You were out in the field, you were magnificent with clients, and you know how they say that you always have someone that kind of fuels you and they mentor you and kind of give you that motivation.
Yes.
And so that's what you did for me. We've been to different places. Absolutely.
Thank you.
So when you see someone as driven as you are, it inspires us to, continue to help others. And so that's why I continue to get in the doctoral field as well, because people like you, Dr. France, makes people like us believe that, we're out here helping others. So I appreciate that.
Thank you.
Don't know how many
And that's all about life. That's what it's about. It's about inspiring. It's about touching other lives. And it's about making that person reach that goal that they're trying to reach. I always tell the young people, there's a star for everyone. Reach up and grab that star because your name is on one of them.
Oh, that's awesome. That's awesome to hear. And so let me ask you one question before we actually start, to discuss mental health and well-being. So for you, when you're out in the field, how do you feel about the mental health, the well-being of it in general? What is your perception of well-being? We don't talk about mental health illnesses, but what about mental health well-being?
So one of the things when you talk about mental health well-being, it's important that you first take care of yourself. I'm going to always push for self-care. Self-care is the number one thing for mental wellness. You have to, being healthy yourself help you to understand your strengths. It puts you in a good place, puts you in a good place mentally. So you have to really be able to take care of yourself. So a lot of times we talk about mental health, and there's certain forms of mental health. So you have mental health, and then you have mental illness. So we're going to talk about mental health. Yeah. So mental health has been in a good space. It's in a space where you're positive. It's a space where you feel good. You're confident in yourself. It's a space where you're able to cope with the stress of life. A lot of times, mental health determines how we're going to cope with life. So if your mental health is well, naturally you're going to do well.
Absolutely.
Because number one thing is, it's about taking care of self. Okay. If we could push that, I think the world would be in a better space. You have to take care of self first before we can take care of anybody around us.
Absolutely, absolutely. And so with that being said, when you talk about us as healthcare professionals and that we have to take care of ourselves before we can take care of others, and I look at it as if we're taking care of a client, say we take care of a client and we're not taking care of ourselves, that reflects them as well, and
it does.
And as far as the mental health well-being, they see it, and so we have to be the best version of ourselves that we can be in order to provide the care for them. So I love how you put that. We have to be healthy ourselves in order to
Yes.
So that's a positive thing that I like. And so what would you say the benefits? So what would be the benefits of the mental health, like the well-being? Like what would you say your number one?
So the benefit of mental wellness is you're happy. You're happy. You're happy. Do you know that a smile is contagious?
Yes.
So if the doctor's happy, right? You bring joy to the patient.
Right.
Right?
Right.
So have you noticed that when you go to see a client and you got this smile on your face, it makes them feel so good. It makes them feel good. So think about it. If your mental well-being is good, it's contagious.
It's contagious.
It's contagious. It spreads.
I like that.
So just think about that. It's contagious.
I like that. Wow. So that's a good, I didn't think of it, when we're seeing patients, we don't think of it as like when we go in and our minds are saying, when we smile, it's contagious. But when we're feeling good about ourselves, we're going to automatically smile. So we don't have to think, we don't have to turn this wheel to say, oh my God, I have to smile today, in order for my patients to love me, and that's what I call superficial. Because if you walk in and it's superficial, it doesn't mean anything in your heart. And that's kind of how I kind of perceive it.
And that's true. That is true.
Right. I like how you just said, in order to take care of yourself, you have to take care of yourself, or else you can't take care of your patients.
Let me tell you, I see patients every day. I see them on the weekend. I see them if somebody calls and say, hey, we need you to come in and see somebody, I'll do it. So one of the things that was very rewarding to me is whenever I go in, I always say, hi, it's Dana. I'm here to see you. And so I walk into my patient's room and they say, hi, it's Dana. And I was like, oh my God. And you get excited and they begin to feel good. You know why they feel good? Because I have shown that, oh my God, I'm so excited that you can remember. And you deal with people that they tell me, I can't even remember my name. So can you imagine how that makes you feel? That means that when you're visiting them, you're making them feel good.
Right.
You're making them feel good about life. I can do that because my mental wellness is good.
Good. I love that. I love that. And so so in a given day, you see many of clients, I see quite a few. And so quite a few. So when you're in there, so when you go into work and it's about the patients first, right? So we know this. So how do you associate, uplifting them? Like even if you're in there and they're having a bad day, and even if we're having a good day, we're trying to motivate, we're trying to get them excited, but they still have that, oh, this is a bad day, nothing went right, my IV, whatever it may be. How do you lift them? How do you that self-talk?
The number one thing is to do is tell me about your day. Tell me, what are you feeling? What are you going through? And then once they are able to tell you, what people want is that ear.
Absolutely.
They want you to listen to them. A lot of times we don't listen. We're just in a hurry. We just blah, 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 blah. But if you take the time to sit and listen, if you listen to people, they love that. And then after that, they begin to open up to you. And then you can say a word of encouragement to them. I have patients, I have several patients that have lost loved ones, that have recently lost their wives. And I go in and they're so sad, and I listen to them and I listen to what they have to say. And at the end, this is what I tell them. I said, I'm so sorry for your loss, but I want you to know this. You have a personal angel that have shared personal space with you on earth that's watching over you.
Oh, wow.
And I wish you could see the smiles on their face when I tell them they now have a personal angel that will never leave them and will always be there. And that makes them feel so good, just to know that I took out the time to say that to them. So it's all in the approach and talking to people.
Yes, it is. It is. And so when you look at, we're going to divert from a little bit from the wellness part of it. So when you look at the mental health aspect of the well-being of it, what would you say mental health versus physical health? Like, how would you associate those two together? Like, what could you tell someone?
So, physical health.
Yes.
It's the body. It's the body. Okay. So when you talk about physical health versus mental health, so we divert. Physical health is body. That's exercise, doing the right thing. Mental health is that mind.
Yes.
You got to be able to have that mind together. And grant you, sometimes we all may venture off into a little depression or a little stress, but we have to be able to pull it back to what makes us be in that good space.
Absolutely. I like that.
So it's a difference. Mind, body.
Mind and body. So do you ever have patients that, they say, hey, doctor, hey, what can you tell me about this? What can I do better? What can I do better in order to, if I can't get my health right, then I know my mental health well-being is not all together. So, what can you tell me? What kind of resources can you give me? Like, what is it that I can do better?
So one of the things with body, you can eat, right?
Right.
Walking is the best exercise you can do.
Right.
Walk. If you can exercise, get in the gym. But for those that can't, even if you're just sitting there, if you're in a home, if you're a person that don't have the strength to do the body, you can just do minor exercise. It's mind over matter.
Absolutely. Mind over matter.
It really is.
I like that. Mind over matter. That's it. That's important. And so what would you say if you would share with someone, not only to give them advice about mental health, what you can do physically with the mental health, well-being and the physical, what kind of resources would you tell them? Like, where would you tell them to go just to even look, like a special thing? Like, what would you say to them?
And can you repeat that?
So in like resources, like if they say, hey, Dr. Friends, like, where's somewhere where can I look up to get some resources? Like what would you for well-being, just well-being, physical health, like
for physical health. I mean,
well-being.
There's so many ways that you can do it. You can refer them to gyms.
Okay.
You can refer them to, there's so many health, Google help things out there.
I like that. Google.
that you can do. But if I was to really just tell somebody, if I was to really trying to get somebody in a really, really good space, I would really just take the time to just talk to them. And once they have really given me what they really want, like if you want a social worker, if you want a psychiatrist, if you want somebody just to talk to, if you want a gym to go to, if you want a weight loss program to do, I would just, you have to first know where you're going for that mental well-being.
I like that, yes.
To even help anyone. Okay. So a lot of times we just speak, but for myself, what I do is I like to pray. I like to read. Okay. I like to run, and I like quiet time. So sometimes when you're working, if you just stop and take 10 minutes of that time and do nothing, clear your mind, don't think, you have to know what it takes to keep your mental health where it is.
Absolutely. I like
and a lot of people don't, because we're stressed out. The world is stressful, so we allow ourselves to be stressed instead of trying to de-stress. Okay. So the key to life is de-stress. Do not let anything stress you to the point where you're wondering if your mind is okay. So those are things you have to really it's going to all go back to this. Self-care.
Self-care.
What makes Dana happy? What takes care of me? It's all about self. You cannot love anybody else if you don't love self.
I like
People
that.
Don't believe that. They don't believe that, but it's true. How can I love a man if I don't love me?
Ooh, I like that.
You can't. Absolutely. You got to take care of self first. And that's all a part of mental wellness, is being able to take care of you and know what you are about and understanding yourself, mind, body, and soul.
I like that. Wow, that's some good tips. Actually, that's a lot of good tips. Because like you said, people really don't understand taking care of yourself is the whole factor in just life. Loving yourself, loving others. And if you can't love yourself, you can't love anybody. I'm not saying that, if you feel bad about yourself one day, I just don't love anybody for that day, but it's like you said, that mind over matter. And so you got to be really positive about it, and be able to put those things into action in order to get that well-being and actually associate it with, this is something that is necessary. And it's necessary. And what I see a lot is that sometimes people don't see it as necessary. We get caught up in the day hustle and bustle of life, and we don't take a step back and say, hey, let me take some time out for myself, because we're so into the things that we have to do in the day.
Right.
And my phrase is, there's not enough time in the day, but unfortunately you have to make time. But
you know what? When you say that, it isn't enough time in a day.
It's
just a matter of you doing the time the way it should be.
Exactly.
So it's definitely enough time in the day. You just have to take the time.
I love that. And that's all. And hey, that's all about that self-awareness and self-care and being able to do it, and I like that.
Yes.
All right. And so I just want to thank you once again, Dr. France, for being on here today. I actually was going to conclude with some of the things that you do, but you've already So I love it. I love it. I love it. And so I guess the key, so the biggest key, if there was one key word, like one catch-all phrase, like one sock it to me, to all our listeners and viewers, what would
And
it
you
be?
know what that's gonna be?
What is it?
Self-care.
Self-care. I love it. I love it.
Self-care.
I love it.
You know what? If I could go around the world and preach self-care, I would.
Right.
Because self-care, you know what? Self-care is what's going to save that mind.
I like that. I like that.
So people have to realize it's about, and I'm not selfish, but I have to take care of me before I can take care of you.
I like that.
And that's a fact.
It's a fact.
So I would say, if anything that I was going to leave the audience with, I will say self-care. You know the benefit of self-care? The benefit of self-care is confidence.
Mm-hmm.
You're
Absolutely.
helpful. You're generally satisfied with life. You're satisfied with yourself. And guess what? You feel good.
You feel good.
You feel
Absolutely.
good. So if you take care of self, a whole lot of people gonna be happy because you know what? They don't have to deal with somebody grouchy because did what you're supposed to do.
We don't need no grouchy doctor in here today. We don't need no grouchy doctor. Oh
Okay.
my gosh. Oh my gosh. I love it. I just want to thank you for joining this episode. This is the first episode of Level Up with Katina as far as with the healthcare and the wellness. So I appreciate you being on, and I know you will be on many, many more to come. I hope that you enjoy it. And so, there's a lot of topics, and what people don't understand is not just the health, the wellness, the mental health. It's all kind of aspects of health. And so you being that doctor that you are, whether it's mental health, physical, or wherever in your field, it's just good to know that there's a journey and that you're able to provide that journey to others and help them think outside of the box, that self-care, your main key topic tip today is self-care awareness. And that's huge. So I appreciate you being on today, and thank you so very much. And I will see you soon.
Thank you.
You are so welcome.
All right.
Bye-bye.